Alrighty, welcome everyone. Thank you for joining this morning. I'll just let you know that the meeting is being recorded at the moment, just so that we can have it in our library if people come in a bit later. I'll just start off by letting you know that we'll use the chat function today, just if you have any questions. And I might ask you to start. A few people are coming through with like just practice manager as the name. I figured out one of them. But if I could get everyone to just jump in the chat now to make sure it's working and pop in which practice you are joining from, that would be really appreciated. Also helps us just to reach back out if you do have any questions. We know who we need to contact. So I'll begin by acknowledging the traditional custodians of the many lands on which we live, work, and gather today. We pay our respects to elders past and present and acknowledge the enduring connection of First Nations people to country. Always was, always will be Aboriginal land. A quick agenda for the day. Essentially, I'll do a bit of an intro and housekeeping. We'll go into what the digital care assessment is. And then we will have a bit of an overview of the assessment and the action plans and how that works. That'll come from Liam, who's with us today. And then we'll have some time for questions at the end. If you have questions throughout, please feel free to still pop them in the chat. We'll be monitoring that, and then we'll jump in and we'll provide those questions, and whoever is relevant will answer them. All right, we've got Total Healthcare, family doctors. We've got someone, oh yeah, that's Liam from Melbourne. And we've got Cardiff. All right, perfect. So, introducing myself, my name's Ibrahim. I am a digital health officer with the PHN. I recently joined them to help leading this project, the digital care assessment. Before the PHN, I was also a practice manager myself for a few years, so I kind of understand some of the challenges with finding time for these kinds of things. So appreciate that you are here today. We also have Marilyn Dixon on the line, who is the digital health manager at the PHN. She was also involved in the last digital care assessment we did in 2022 for general practice, and comes from a GP nursing background. We have Jenny from our education team helping with a bit of support, and we have Liam from Semantic, who are our partners in the project. So moving on. So what is the digital care assessment? What are we talking about today? Sure, it's muted. So the digital care assessment is an online assessment developed by our partners at Semantic. It's designed to help practices understand their digital capabilities. It looks at key areas like digital infrastructure, technology use, digital and data literacy, staff and patient readiness, and clinical leadership. This is the second time, as I mentioned before, that we've done this assessment for the region. Some of you might have been here for 2022. But since then, it has been expanded upon quite significantly. A number of other regions across Australia have also used the same assessment. And so from the feedback within those regions over the last 3 years, Semantic have really been able to flesh it out, provide more relevant resources, and asking better questions to help us push practices in the right direction and support you guys. So why it matters to us. As digital health continues to become a more prominent feature of general practice, we at the PHN aim to use the results from the assessment to directly inform our digital health strategies, with the goal of ensuring that practices at a more foundational level receive the support they need, so things like meeting accreditation standards, and that those practices who are already engaged in using digital health tools at a more advanced level are supported to continue to innovate. But we don't want to just come in, collect the information, and then run away and you never hear from us. So we want this to be really informative and really helpful for practices. So we want you to come out with tools and resources, whether that's just an awareness to start with or actually beginning to implement those tools. We want to help you identify strengths and growth areas within your practice. One of the big things that will come out of this assessment will be the digital care action plans, which Liam will show us a little bit later, but essentially is a plan, sort of step by step, based on the answers you give, instruction and sort of clear action items that you can take, work on in your own time. These action plans will also support practices in meeting things like accreditation requirements, because each of the items is linked to accreditation criteria, but also you can use these as proof of quality improvement. So the basic details of how to participate. You should have already received a link from Kaleidoscope, which is Symantec's platform that the assessment is run through. It'll look something like that, and Liam will show us a bit more later. Each link is unique to the practice, but if you receive it at the reception email and you want to forward it to the manager, just forward the email to them and they'll be able to access it through that link. The assessment opened on the 20th of May and will remain open until the 30th of June. We did extend it just due to some of the severe weather that's happened across our region. So we want to make sure that everyone's got a chance to jump in and complete that and benefit from it. It is about 30 minutes to complete the assessment. A quick note that you kind of need to do it in one session on your browser. So if you come in and start it, there's not a way to save it and come back later. But if you just leave your browser window open, it won't go anywhere. It's not going to close itself out. This is the third of our provider webinars. So after this, we'll make the video available in our library, but you are also welcome to reach out to the digital health team and myself. My phone number is there, and digitalhealth@thphn.com.au is the best place to contact us. We're happy to answer any questions. If you want someone to sit with you and go through the assessment with you, I'm more than happy to do that. So with all of that, I will hand over to Liam from Symantec, who will give you a bit of a run through of the assessment and the action plans. Thanks, Liam.
Thanks, Ibby. Morning, everyone. My name's Liam Carl, and I'm a consultant at Symantec Consulting. So we are a small digital health consulting company that do a lot of work alongside primary health networks, as well as work with government and technology vendors, including general practice software partners. So we work across digital health maturity assessments like this, as well as general practice sustainability, and supporting the development of digital health strategy as well. So we have a lot of experience in this space with general practices. So we've now surveyed or had responses from more than 1,500 general practices across Australia, and that's across 13 different primary health networks. So we've had the opportunity now to refine this assessment and really make sure that we're capturing meaningful insights that are going to help the primary health networks to help you. So I just wanted to give you a bit of a look at getting started today with completing the digital care assessment. I'm not going to go through the whole thing. As Ibby said, it's designed to be completed in about half an hour. And at the moment, the median time is sitting around a bit below that as well. So you're a speedy bunch at the moment up in Hunter, New England. So I'm just going to share my screen and show you the invitation email. Now, this is a look at what the invitation email back on the launch day would have looked like. We are also sending through weekly reminder emails, just to make sure that if it's been lost somewhere in your inbox amongst your flood of emails, we'll bring that up to the top of your email inbox for you, with a bit of reminder. So these emails will come from notifications@kaleidoscope.care is the email address. So that Kaleidoscope is our platform where we host all of these different assessments, and that enables us to collect everything and then dive deeper by analysing those results to really make sure that we're making the most of all of the feedback that we're collecting from you. So you'll see that there's a bit of a spiel here, some of the ways that the DCA can help you. And then down the bottom, you've got a link that you can click on to open up your unique email invitation to get started. So when you first open up this link, you'll be taken to the introduction and consent page. Now, you've got a bit of info to read through here to tell you what it's all about. And you'll also see that your name here, which will populate so that we know who's completing this. Now, to get started, you need to find your region first. So there's a nice variety of regions here in the Hunter New England PHN. So find your region, and once you've selected your region, you can then go down to the practice names list. And we will then filter that list to bring up your practice using that region that you've already selected. Good to see a little bit of activity in the chat already as well. So that's great that we can hopefully answer some of your questions while you've come along today. So once you've chosen your practice, you can actually choose a couple of different practices and complete the same response for multiple practices. So if any of you are managing multiple practices, that is an option. But we do just want you to keep in mind, as we've highlighted here, that if you're going to be doing that, we want to make sure that the same response is actually going to apply for those multiple practices, and that you've got similar processes and culture and technology across those different practices. And that's important because when we then get to the end of the assessment and you're provided with a tailored digital care action plan, we want to make sure that those actions are going to be relevant to each of those practices. So right down the bottom of the page here, we've got some more information about exactly how your data is going to be used. And then once you're happy with that, if you consent, you can click on yes and continue. So up along the top here gives you a bit of a picture of all the different categories that the digital care assessment will touch on. So you can see, you might not be able to see actually because it might be small on your screen, but we've got things like disaster recovery, medications, the practice incentive program, models of care, as well as asking about digital literacy in your practice and clinical leadership. So it really covers a whole range of different topics, and might be some topics that you don't traditionally think of as being linked to digital health. But one of the things that we like to do with this digital care assessment is really broaden everyone's perspectives on exactly what digital health covers. So completing the assessment will typically use multiple choice options. So some of these will be just one option that you're able to choose. It will say to you, select all that apply if you do have the option of choosing multiple answers for the same question. And we also like to use, as you can see down the bottom here, we like to use a bit of a grouping rather than asking you for specific numbers for different things. So like what percentage of your patients are bulk billed. We've given you some ranges there, similar to finding out about the average age of general practitioners. We're not asking you to get any exact numbers or do any tough maths. We're trying to make this as easy for you to do as possible without having to consult any calculator or any sources of information in your practice. So I won't go through all of it now, but I will just skip ahead to one that I've got a bit of a jump start on earlier, just to give you a look at a different type of question here. So based on your response, you'll see some different options. So if we look at Provider Connect Australia, for example, if you say that you're not registered to use Provider Connect Australia, we might then ask you why not. Now, that's not to make any sort of judgment on you or your practice about why you're not doing something, but it's just to get a bit of a deeper understanding as to what some of those barriers might be and some of those reasons out there in the general practices in the PHN's region. So you might say, and this is an example of one that has multiple choices that you can choose. You might say you don't know what PCA is, or that the registration process is too hard and too time consuming. And that will then really, across all of the different responses collected, start to paint a really meaningful picture of some of the barriers being faced by general practices for different digital health initiatives. And the last little section I'll just touch on here is the additional feedback section. So this one has some free text boxes where you can go to town and type out a nice long response if you feel like it, or you can keep it nice and short. So we'll ask if we've missed anything. You can let us know any topics that you think we've missed. You can also then really clearly articulate the type of digital health support you would like from the PHN, as well as any training or education topics you might like. And then we'll ask you, how would you like to receive that training or education? So this is really going to, alongside the insights collected from all of the questions, this is really explicitly going to say what are the needs and the wants in terms of education for digital health from the PHN. And then once you've come down all the way to the bottom here, the complete button is that final button that you need to hit to submit your responses. So that's completing the assessment. As Ibi mentioned earlier, the digital care action plan is something that you will get in return for your time that you've given up to complete the assessment. So the digital care action plan will be sent to you following the conclusion or the closure of the assessment. So the assessment is closing on the 30th of June. And the action plans are tailored to your practice based on your responses. So you'll get a bit of an email, and the email will give a bit of information about where you've been assessed at being based on your answers, some of the key areas that you'll need to focus on. And it'll also include a nice little chart here showing across some of those key categories how your practice compares to the average for the PHN. So that can show you some areas that you can really hone in on. We'll include a copy of your answers to all of the different questions, so that if you can't remember exactly what you did a couple of weeks later, you can read through this if you're interested, or it might even give you a chance to go back and think, what was that PCA that they were asking about in the assessment? So you can go back through there and look at all of that. So that's a good one. And then this is the action plan here. So I might just open that up. That's a bit easier for you to see. So the action plan here has a few different columns to look at. So the first one is an action. So we'll say you might need to read the fact sheet on preventing and recovering from ransomware. We'll include a link that you can click on to go straight to the recommended resource for that. And we'll also tell you why this resource has been recommended. So this particular one up the top row here has been recommended because during the assessment, when you're asked if staff have a good awareness of how to minimize the chances of a ransomware attack, you answer disagree. So that this here as well, if you're looking at this action plan in 3, 4, 5 months down the track, this will be a bit of a reminder as to why this is a little area of focus for you. It might be a little bit hard to see on your screens, but we actually have these top 3 actions separated from the rest. And that's because we like to say, if you're going to start anywhere, start with these first 3 actions. And then once you've got the extra time or the extra capacity, you can then work your way down the rest of that action plan. We don't expect all these things to be completed within a certain time frame at all. These are all just things that are there to support you and trying to really respond to the needs that have been identified through the questions in the assessment. I think that's enough of my voice. I'd be really keen to hear if there's any questions that has brought to mind for anyone, or if anyone's completed the assessment and has any follow-up questions at all. I'll hand back to Ibby and hope to hear from a few of you.
Yeah, thanks, Liam. Chat seems to be pretty busy, which is really good to see. I'll just let you know, so you can email us at digitalhealth@thephn.com.au if you have anything after this, or we'll give it a few minutes. Feel free to chuck any questions in the chat if there's anything anyone wants to know. I will just confirm with the action plans, they will go out at the end, like after the assessment has closed, rather than sort of as you're completing. We're just finalizing all the resources, so we want to make sure everything's ready to go before we send them out. But we're really conscious that we want to get them out not too long afterwards, so we'll try and make that as quick as we can. There is an evaluation link that Jenny has sent through in the chat. So if you do have a couple of minutes after this finishes, please jump on there, let us know if this has been helpful for you and ways we might be able to help you in future. All right, any questions?
No, nothing that I can see, Ibby.
No, perfect. All right.
A couple of people have asked to tell us which practice they're from, but I don't know if they can respond in the chat or even just reach out to you and let you know. That'd be great.
Yeah,
just because we.
Yeah, perfect. All right. Well, what we'll do, we might just call it there. Oh, hang on. See a question coming through, but I'll stay on for a few minutes. If anyone has any questions, please feel free to jump in. But otherwise, thank you everyone for joining us. We really appreciate you being here today.